Bipolar disorder is a prevalent issue people around the world face. Celebrities such as Carrie Fisher, Kanye West, Selena Gomez, Mariah Carey, Robert Downey Jr., and Halsey are a few names that are diagnosed with this disorder. That being said, what is bipolar disorder, and how do you know you have it? Bipolar disorder is a mental illness characterized by mood swings. People with bipolar disorder are characterized by undergoing highs, known as manic episodes, and lows, known as depressive episodes. These episodes can last days to weeks and will cause changes to a person's energy, concentration, activity levels, and mood. Bipolar disorder is diagnosed by first ruling out all other illnesses through physical exams by your healthcare provider. Then the individual will be referred to a mental health professional where they will be assessed and asked a series of questions.
In Canada, approximately 2 out of every 100 people experience bipolar disorder. The most common types of bipolar disorder are types 1 and 2. To be diagnosed as a person with bipolar 1 disorder, you need to have experienced at least one manic episode that lasted over 7 days. With this type, major low or depressive episodes may not be experienced. Characteristics of manic episodes may include inflated self-esteem, less sleep, lowered concentration, a compulsion to continue talking, and excessive activity involvement. As an example, Kanye West reported having insomnia and experiencing manic episodes due to sleep deprivation, but he was actually diagnosed with bipolar 1 disorder in 2016. To be diagnosed with type 2 bipolar disorder, a person needs to experience a major depressive episode lasting over 2 weeks, in addition to at least one hypomanic episode. Hypomanic episodes are basically just less intense manic episodes. Sometimes this type of bipolar disorder is mistaken for depression because an individual can solely experience depressive episodes and no manic episodes. This is the case for Selena Gomez, who experiences month-long depressive episodes where she often has suicidal thoughts. Characteristics of major depressive episodes can include extreme weight loss or weight gain, insomnia or hypersomnia, fatigue, and suicidal thoughts.
No one knows the exact reason why bipolar disorder arises in a person. However, it is generally said to be a combination of various neurochemical, genetic, and environmental factors that causes bipolar disorder. Genetic inheritance plays a major role, as bipolar disorder has a 70 to 80% heritability rate. Specific genes have yet to be identified, but around 30 loci associated with ion channels, neurotransmitters, and synaptic development have been demonstrated to have links to bipolar disorder. These genetic factors often result in various neurochemical changes, which includes alterations in brain-derived neurotrophic factor, nerve growth factor, neurotrophin 3, and neurotrophin 4. As previously mentioned, there are various environmental factors that could play a role in the development of bipolar disorder, which includes childhood trauma, stressful events, medication, drugs, and alcohol.
Individuals with bipolar disorder experience unusually intense and extreme emotional states during distinct periods called mood episodes. These episodes can be divided into 2 different kinds. One is a manic episode in which a person experiences an overwhelming feeling of joy or excitement. The signs and symptoms of a manic episode include exaggerated self-esteem, reduced need for sleep, aggressive behavior, rapid speech or overly talkative, easily distracted and impulsive behavior, taking part in pleasurable yet high-risk behavior. Is there a celebrity that comes to mind when you think of manic episodes? Rapper and entrepreneur Kanye West was diagnosed with bipolar disorder in 2016. He is described having manic episodes with symptoms including racing thoughts, irritability, sleep loss, and paranoia or psychosis. Kanye has the habit of doing many activities at once, scheduling more events in a day than can be accomplished, which are signs of manic behavior. Kanye is also known to make tall claims, praising of himself as "I'm the greatest human artist of all time," as well as being egoistic, which are signs of having an exaggerated self-esteem. The other types of episode a person can experience are called depressive episodes, in which a person feels extremely sad or hopeless. The signs and symptoms of this type of episode include hopelessness, anxiety, sadness, guilt, fatigue, loss of interest in daily activities, difficulty concentrating, remembering, and making decisions, and suicidal thoughts. Another familiar face who is experiencing episodes of depression is Selena Gomez, who has described her episodes as, "It would start with depression, then it would go into isolation. Then it just wasn't being able to move from my bed. I didn't want anyone to talk to me. Selena's revival tour in 2016 had to cancel in August as Selena was having suicidal thoughts and felt that she was no longer in control of her emotions, whether they were good or bad feelings. Sometimes a person can have a mood episode which consists of both mania and depression, and this is called a mixed state.
Treatment and management of bipolar disorder falls into 3 categories: long-term management, treatment during manic episodes, and finally, treatment during depressive episodes. So in terms of long-term maintenance and management, long-term use of mood stabilizers such as lithium carbonate and/or antipsychotics like clozapine are recommended for those with bipolar disorder. Psychotherapy and suicide surveillance are also used when required. During manic episodes, use of benzodiazepines, antipsychotics, and mood stabilizers are recommended. Benzodiazepines act as a central nervous system depressant, meaning they effectively slow brain activity. Antidepressant use is also halted during manic episodes. And finally, electroconvulsive therapy, or ECT, is used on those who seem to be treatment-resistant or pregnant. And this is because mood stabilizers that would otherwise be prescribed have been shown to cause birth defects. Finally, during depressive episodes, there is a combination therapy of antidepressants and mood stabilizers that is recommended. Additionally, cognitive behavioral therapy is used in conjunction with these previously mentioned pharmacological treatments. Another example of an effective psychotherapy used for treatment of bipolar disorder would be interpersonal and social rhythm therapy, which is often abbreviated as IPSRT. Finally, ECT is also used for those deemed at high risk of suicide.
If you resonate with any of the symptoms mentioned in this video, please seek professional help as we are not experts in this field.